The training to train people to improve or to increase or decrease a particular brain activity, written or metabolic thing. Usually you shouldn't give instructions for this, because people find out themselves, and animals find out themselves, what's the best strategy for a particular rhythm. So the best thing is to just give a vague instructions in people who are interested in instruction. You say, well, this is your brain waves, and you see on the computer screen, when the brain wave gets more brain waves, it will become red, and when it's less brain waves, it's blue. Now for this task, please make the screen as red as possible and use whatever you like, except movement. Use any thought, any emotion you want to use, and watch the feedback, and the feedback will tell you what's right and wrong. That's the best instruction. Now, of course, patients ask you all the time, what, after 2 sessions, no effect, they're desperate, and they say, what can I do? And then my people, of course, most of them some are psychologists, and they get tears in their eyes, and then they say, okay, okay, imagine a movement, imagine the movement. And we showed, and others showed, that this is not a good strategy. People then start imagining all kind of crazy movements, and what's better is than those people who are really bad, we show them a hand on a screen moving. So when they see another hand moving the way we want them to think about movement, they can learn fairly rapidly to move their hand. So this is a few strategies. In the emotional brain-computer interface, when you want to change the activity like the activity of the insula, or the activity of the amygdala, which is related to fear, then of course you would tend to tell them, listen, imagine something fearful scenes in your life, and then the amygdala goes up in activity. That is true, it does. But since the amygdala has many other functions, which has nothing to do with fear, you can never be sure that the instruction to imagine something fearful is the best one. So again, my advice to my people, they don't follow my advice very often, but is don't give them instructions. And it should work with pure reward. It's the reward, the contingency, which is the necessary condition that the brain follows the contingency. And if the contingency is reliably right, the people will learn it. And then, of course, people after 10 sessions, like training the amygdala, they say, I feel bad. They say it spontaneously. And when you give them slides, judging them slides, positive, negative slides, they all reliably judge the negative slides as more negative. So I don't need the instruction for this. And it's much more spontaneous, and it's for the people, it's easier. The second reason why I don't like instructions is because most of our patients are so sick and so ill and have so many cognitive deficits that in the majority they don't understand the instruction anyway. So why instructing them? You know, this stuff any rat can learn that. Why should I give instruction? I cannot ask a rat, imagine a fearful situation, and the rat will learn it perfectly. So that's not good strategy. But you know, people, particular psychologists, have this tendency to translate everything in words, and it's difficult to block that.